The next injector is a top injector with Allergan, and he's one of 12 in the USA that is a Master Injector Trainer. So he's an educator for top doctors all over the world. He's American board certified plastic surgeon. So yes, he does surgery, but he is an expert in non-surgical procedures.
So what I want to show you is how do you treat the male face? The male face is treated very differently than the female face because obviously if you treat them the same, you're going to either feminize the male or masculinize the woman, okay? So you really want to look at facial characteristics. So for my female patients, I would tend to bring the malar eminence out this way, okay? I want to lift that up. I want to put the light reflecting point high and lateral. If I do that for my male patients and give them high and lateral, I'm going to give them cheekbones. I'm going to give them a very feminized look. Instead, what I'm looking at is, if you look, there's a break right here, okay? And I'm going to kind of outline this a little bit. So I'm not going to outline it entirely because I want to actually inject through there, but that's where I'm going to inject. And what I'm trying to do is, I'm trying to lift this like that and create more continuity. That's essentially what I'm trying to create. I'm not trying to create cheekbones. I'm trying to restore continuity. He doesn't have any volume loss down here, so you really don't need to put volume down here. He doesn't need any volume up here because again, if I put it up there, it's going to feminize him. I tend to use hyaluronic acid, HA products. If you don't like them, you can dissolve them. I rarely have to do that. And then Botox-wise, pretty straightforward. I'm going to go prophylactically, okay? I'm going to treat the glabellar area. I'm going to treat a little bit laterally as well too. I want to give them a little bit of an arch, not much. I don't want to feminize them. And I also too want to go a little bit around the crow's feet. And I also too want to go centrally here as well too. Scrunch your nose up like you're smelling something. Those are called the bunny lines. Those are no bueno, all right? You want to get rid of those things. So I treat here and I'm going to treat laterally as well too. You don't want to go too far down on the nasal sidewall because you can hit the zygomaticus major minor. You do that, you're going to affect the way that Joaquin smiles. Joaquin will then come in your office and be very irritated at you. Okay, so don't do that. So total of 40 units there. I always do my fillers first because I'm going to need to go and mold them, and then I'm going to do my toxin.